PREVAIL is about enzalutamide. Enzalutamide is a androgen receptor inhibitors. It is a second class of drug together with the CYP17 inhibitors such as abiraterone that we can use in patients progressing on castration. Enzalutamide has been tested and approved in patients who fail chemotherapy. It has not been tested. This is a PREVAIL trial in patients who are actually not having received chemotherapy yet. We show that we can delay progression, we can delay time to chemotherapy, and we can improve overall survival. One of the advantages of enzalutamide is that the drug does not require to be combined with prednisone, and this is a very convenient way of treating these patients. I think that now for us urologists, it's an important message because we have two drugs to delay chemotherapy, abiraterone and enzalutamide. We're going to have to learn how to sequence and combine, but for us, a major change. It is a major change for competitors as well, because now the question is, how do we register new drug in that extremely competitive environment? Because as a urologist now I have two extremely powerful drugs to use in my patient progressing on ADT. I think that clearly the landscape of prostate cancer has been totally changed in the last 2 years. In 2004, we had chemotherapy. We should recognize first that probably no more than 50–60% of patients are fit for chemotherapy. So having drug after chemotherapy, so having chemotherapy as an obligatory hurdle, it is a form of discrimination for 40–50% of the patient. And still, many of the patients fit for chemotherapy would like to delay chemotherapy. So now we have drug to do that effectively. You should not be afraid of monitoring your patient, and you should not be afraid to start drug to delay the administration of chemotherapy. You have to learn to administer abiraterone acetate and enzalutamide because really these are two drugs with great benefit for our patient.